Hello, friends. Welcome to UK Dreamers. I am Dr. Aman, and today we'll be talking about my IMT interview experience. In the previous video, as I told, I switched my specialty from A&E, that is accident emergency, to internal medicine. And yes, with that in mind, I gave my IMT interviews. And yes, I got a place in Midlands, and I'll give you a brief overview about my journey. I won't be giving the details basically per se, because of the confidentiality that we have with the HEE. And yes, I do not represent the GMC, nor the NHS, nor the deaneries, nor the Royal Colleges. It's just my own experience for colleagues who want to apply for IMT training in the future. So, as I said, I switched to the medicine. Yeah. And then you want to evolve, you want to train. So the applications usually open for the round 1 for IMT in November. This year there is no round 2 because the places have all been filled basically, but yes, there's a round 2 in August as well. So for the round 1, let's talk about the round 1. For round 1, the applications open in November. All you need is your CREST form and a valid GMC license for you to apply. Once you've applied, there's a scoring system on it. You need to give your evidences. For instance, you've attended the conferences, you've attended the workshops, you've done some teaching, you've done some quality audit projects and whatnot. So you need to score yourself. Once you've done the scoring and everything, you submit your application. The recruitment office would process your application, and if you're shortlisted, you'll get an email stating, okay, you've been shortlisted, you need to book your interview slots. So what happens is, with IMT, you might not get the same deanery to interview you. For instance, I stay in Midlands. The moment I opened it up, there was no slots available at Midlands. So I took the deanery of Sussex for the interview per se. So you can opt any of the deaneries. It doesn't make a difference in your recruitment or the preference that you want to place. It's interview, different deaneries take, that's all. So once you start with the interviews, I would give you a brief overview how the interview goes like. And I can't give you the explicit details about the questions asked or who were the examiners and everything. So the interview basically consists of 4 stations. The first station is the clinical station. You'd be asked a clinical scenario. Yeah, they would read the clinical scenario and you'll get some time to prepare, and then the interviewers would be usually this year it's online. If it gets back to face to face or online, I think pattern would still be more or less same. So you've got a clinical scenario. I'm not going to tell which one I got. Let's give a general overview. So you've got a 60-year-old gentleman who's coming with some chest discomfort. Yeah, and how do you approach to this patient? So this is sort of scenario. The same can be with abdo pain, the same can be with shortness of breath, the same can be headache, whatnot. A basic scenario. So how do you approach? So yes, for everything you have to do the ABCDE approach. With the ABCDE and the adjuncts, you explain, give your reasonings. They would ask you what else. For instance, a chest pain, if we talk about, yes, a ECG, yes, a troponin, a good collateral history. Anyone who's above 60, you should think about aortic aneurysm and whatnot. So make sure you keep your mind open, because this interview slot is just 20 minutes. 5 minutes is for your clinical scenarios. The next scenario comes to be ethical scenario. So ethical scenario is very, very important in the UK. That's how the system works, because they believe that we can do errors, and they also believe that if an error has happened, how do we deal with the error, because we are humans at the end. So you might get any scenario, like for instance, some patients medications got missed, or while discharging, maybe his outpatient's appointment did not go through. How do you deal with such cases? So it depends on cases to cases. If you follow the GMC good practice, this is all mostly mentioned in those. So once you've made sure you've explained things and everything, there are few things in the UK, like for instance, if there was actually a threat to a patient's safety, what do you do? So you raise a concern, you do a DATEX, like the few things, specific terms that they want to hear from you in the interview. The third station was the commitment to specialty. Trust me, guys, this station I was horrified because I'm not from the medicine background, internal medicine background. I'm from A&E background. All, if you open up my portfolio and everything, it's all acute, all A&E. And how would have I convinced the interviewers like I'm actually wanting to commit to internal medicine? So the biggest commitment I would say was I left A&E and I joined medicine to work with, which itself did a big thing on my part, because they were convinced, okay, this guy might would have been a A&E guy, but now he's actually looking forward to come into medicine. And plus they did ask me like about the exams, and also you must be a little oriented about the MRCP exams. When are the exams happening? When are you planning to write the exams? And that will turn good on you. The fourth station is like achievements and all. So as you know, I'm a YouTuber now, a budding YouTuber. So they did ask me what do I do. So I did tell them about the channel. I did them that I'm doing this and this. So they were very that caught them. That caught me with a surprise, because I thought maybe it'll just be a small thing, but they really liked it. So what I would suggest for everyone, guys, whatever you are passionate about, whatever you do outside medicine, outside the hospital, make sure you have proof for it. For instance, you like to do a mountain hiking, have some proof of it, because you might would have attended some workshops, you might would have done some mountain climbing and some summits, and make sure you've got proof for that. If you love cooking, make sure you've attended few of the cooking competitions or something, so that you get some certificates, and that will act as a proof. The same, you love painting, participate in painting competitions, get a proof. You love cycling, go to marathons. The whole concept is, if you don't have a proof for whatever you're doing, you're not passionate enough. If you're not passionate enough, you will not get marks. I would also share you on the screen like what do they score you for. The only station where I scored very less was the application itself. So writing the application, presenting the application and everything, since foreign graduates, we are not much used to what they are expecting us to see. So there's a good interview book. I'll give you the details in the description. You should buy that book. To be honest, one of my colleagues, he's IMT 2 now. So I asked him about the interview patterns and everything. So they actually suggested me to read about this book, which I did, and to be honest, it really helped me a lot. Any interview in the UK, I would definitely suggest that you go with the interview book. So yes, once you've gathered all the evidences, you have thrown your best to the interviewers, and you can definitely succeed. I am not bragging about myself, but I thought maybe I'll just pass. I might get the place or not, or whatnot. But they interviewed about 2,700 people, I think, and there were about 1,500 posts for the internal medicine trainees. My rank was 194 in the UK. And as I said, a guy like me who has no medicine background comes to this, gives an interview, cracks the interview, gets an offer. Why can't you? So yes, my first preference was the place where I am right now in Wolverhampton, because I love the city, whatnot. So I applied for that. I did get that. I applied, with IMT you can get the specific preference of the subspecialties that you want. So once you have your results, you'll get the preference list. You can fill the preference list according to the places you want to go. Once everything is sorted, you will get an offer. You might accept the offer straight away like I did, or you may accept it with an upgrade. Like for instance, you did not get the places where you wanted first, so you can always keep on upgrading the list. Once there's a deadline, like this year the 4th April, 11th April were the deadline dates. I'm not very sure. You can have a look at the website. Once you've accepted, then once you've accepted the place, you have actually entered into the training in the UK. So slowly you would be getting granted a training number, and your visa and everything will accordingly change according to the training. Like for IMT you would get 3 years. Like if you get into a run-through training, for example, you get into ACCS emergency medicine, you get your visa is sorted till you get the ILR. So guys, thank you so much for watching. Keep rocking, keep preparing, and make sure you get into some or the other training. Thank you so much. Cheers. Bye bye.